My name's Gershon Kutsi and you're watching Mallow TV. October is Breast Cancer Awareness Month, and recently we visited Mallomed Tokai, where we spoke to specialist physician and breast specialist Dr. Sizwe Makhoba and plastic surgeon Dr. Azzaam Najjaar. We also spoke to a breast cancer survivor and the Oncology unit manager.
So this particular month, I always try and encourage people. Most important thing is screening. You want to pick up cancer quite early. You want to make sure that you pick it up while it's still in stage 1. There's 4 stages. Stage 1 to stage 4, and stage 4 is obviously where cancer has spread. Now we don't want to pick up cancer when cancer has spread. We want to pick it up early. That's the real message that we want to impart. Most lumps are actually not cancerous lumps. However, as a woman or even as a male, and males, that's a different story. The moment you pick up a breast lump, you immediately start thinking the worst thing, and that's a natural human thing. So my job as a specialist, as breast specialist, to make sure that you're comfortable and that we go through all the relevant processes in terms of trying to pick up whether this lump is cancerous or it's a non-cancerous lump.
Hi, I'm Camilah, 51 years old. I was diagnosed 6 years ago. I'm a survivor. In September 2017, I was diagnosed with breast cancer. I had a radical right mastectomy and some lymph nodes were involved, so they removed those as well. I had chemo here at Tokai Mallomed. I was under Dr. Parker, Sister Zelda, Camilah doing my chemo. An amazing journey. I've survived, I'm alive, I'm very grateful to them.
At our oncology unit, we have breast cancer patients who receive treatment here. And I must say, the journey in this unit with our breast cancer patients is a beautiful one. For the fact is that we have a lovely team who supports our patients and families in so many different ways. And for me, it is an absolute beautiful journey, where the fact is that I am a breast cancer patient as well, going through my own journey. And just speaking to our breast cancer patients, me supporting them, and in an indirect way they support me, which makes this unit such a beautiful place to be.
The support at Mallomed Tokai Oncology is phenomenal. They are your strength. They support you, they help you, they do everything to make you comfortable. I would come in, they'd give me teddies and blankets and cushions and feed me. I thought I couldn't eat during chemo. They fed me and I managed to actually stay healthy with their help.
Where we see each other as sisters, caring for each other, looking for each other, looking out for each other, and just making the day a beautiful one, irrespective of the type of treatment they're getting, chemotherapy. Yes, at the end of the day, our patients walk out here with so much love and knowing that they've got hope for tomorrow.
At Mallomed Tokai, we house a successful breast clinic that has a multidisciplinary approach to assist you during your journey.
Yes, we do, and the breast clinic has been running now for over a number of years. I think it's at least the 5th year now, and it's a multidisciplinary approach. We've got an oncologist, we've got a pathologist, we've got a radiologist, a plastic surgeon that we work with as well, because we know the impact of losing a vital part of your body is.
So as plastic surgeons, we get involved with the reconstruction post-mastectomy. The reconstruction is either done in the immediate setting at the time when the mastectomy is done, or as a delayed reconstruction once the chemotherapy and radiotherapy has been complete. The patient then comes back in a delayed sort of setup for us to assist her with the reconstruction. For many patients, being a woman is associated with having breasts, and that's exactly the purpose that we fulfill as plastic surgeons. We provide a service where we reconstruct the breast and allow a patient to once again feel like a woman.
If you are fearing, I would say to you, knowledge is power. Once you know, you can do something about it. when you don't know, it can get so much worse. Go and find out and get support. There's so much support out there.
My message to you, if you've been diagnosed within the last year or two, don't give up. There's hope for your future. It's a beautiful journey. Get involved with support groups, families, at your unit, like our unit here at Malamed Tukai Oncology. We have a beautiful family which includes the pharmacists, the doctors, the nurses, and we are here to support you, guide you in whatever way possible we can. So the journey itself, it's a beautiful one. Just allow your team and your loved ones to hold your hand and to walk this journey.
The same advice that I tell most of my patients, is that it's better to know than not to know. You'd rather know, and if you do know, you'd rather know early, because then you can at least intervene somewhere along the line. And I think that's one of the mistakes that a lot of people do make, is that they sit on a particular problem until it's far too late. And then by that time, things change. We might have done a small operation, now we're doing a bigger operation. You might not have needed chemotherapy, now you need chemotherapy. So my advice would be, the moment you feel something, even if you think it's nothing in the breast, you shouldn't really be having breast lumps in there. But the moment you feel a lump, you'd rather just get it checked out. And with Women's Month at the moment, then we do have some certain discounts from the radiology, Morton and Partners. I think they're offering about a 30% discount on private patients, for the mammograms and things like that. And we have a special arrangement. If someone comes through during Women's Month, we also sort of, our fees are not the same as as during the rest of the year. So there's help readily available within the Malamed Group and within my practice on its own.
Thank you to our specialists for their sound advice regarding breast cancer. And as you heard, it is imperative to do early screening, and once you know the outcome, to receive the adequate health care and support. If you know of someone, perhaps a family member or a friend, that will find this video helpful, please like and share. From all of us at Malamed, take care of yourself and take care of your loved ones. Until next time, goodbye.